applying to residency program can be a challenge, especially programs like oral surgery. There's a lot to prepare for. Doc, tell us what was the hardest thing about this process applying to oral surgery for you?
Firstly, I want to say thank you for having me. The hardest part about this process, applying the oral maxillofacial surgery, as you know, there are many challenging aspects of the application process, such as academic excellence, standardized testing, intense competition, excellence in clinical skills, building a strong network. However, the hardest thing about this process, in my opinion, was resilience and coping with rejection. And what I mean by that is the journey can be mentally taxing and it often involves facing rejection. Candidates sometimes need to apply to multiple programs over several years, potentially dealing with feelings of self doubt, imposter syndrome, and discouragement. But ultimately, each part of that process is a major hurdle, but together they develop your resilience, perseverance, skills, and mindset to have a successful career in oral maxillofacial surgery.
Sounds good. So it sounds like the hardest part really was getting to yes. And before you get to yes, you may have to get to some no's and some
A
challenges,
lot,
right?
a lot of no's.
Yeah, yeah. Gotcha. Gotcha. Becoming an oral surgery doctor, an oral surgeon, I should say, not an oral surgery doctor, but an oral surgeon, a board certified oral maxillofacial surgeon. Uh, it's a very long and tedious commitment. Stay tuned as we talk to a doc who got into oral surgery. He's going to tell us all about how he did it, his challenges, but also his successes. Stay tuned. Hey, this is Dr. Darwin, and welcome to another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, getting into residency, and then life as a new dentist. Guys, be sure to continue to share this content. Subscribe. Only about 15% of the people that are watching these videos are subscribed. So we need some more of you to subscribe. All right. Also, comment down below and tell us more about things that you liked about these videos and the podcast so that we can continue to bring this content to you. All right. Also, this episode of Ask Dr. Darwin is being brought to you by getintodentalresidency.com. That's right. Look down below. Dentalresidency.com, the ultimate resource to help you navigate the process of getting some advanced dental education and also getting to board certification as a specialist. For more details, check the link down below, and we hope to see you in our upcoming training very soon. So today we have a special guest who's back after 3 years of finishing up dental school, and now he's at it again, is en route, and he's going to be talking a little bit more about his journey into oral surgery. Dr. Reed, welcome back. How you doing, man?
I'm doing great. Thank you for having me.
You're welcome. You're welcome. So give us a brief introduction. Tell us about yourself for those that maybe didn't watch the last episode a couple years ago, so we know a little bit more about you.
All right. So, hello, everyone and future surgeons. I am Dr. Sheream Reed, a captain of the U.S. Army and current advanced education and general dentistry resident at Joint Base Lewis McChord in Tacoma, Washington. I'm a native Philadelphian, achieving my Bachelor's of Science in Natural Science at the University of Pittsburgh, Master's of Biomedical Sciences at Geisinger Commonwealth School of Medicine in 2018, Master's of Health Sciences at Meharry Medical College in 2020. I hold certificates in public health and health policy while achieving my doctorate of dental surgery degree in 2024 at Meharry Medical College School of Dentistry. And I am delighted to be here today. Thank you.
You're welcome, man. And thank you for sharing your time. So we're going to jump right into it because people need the time not only to watch this video and watch it again and make sure that you're staying through all the way through to the end. So when Dr. Reed gives some tips and some strategies. You know what and how to apply those for your potential applications. Um, so let's just get into it. Why oral surgery? Because as you know, and I know, and we know, there are other specialties besides oral surgery. But what about oral surgery for you made it stand out when you were like, yep, this is my pathway. This is what I got to do. I don't want to do general dentistry. I don't want to do pedo. I want to do oral surgery.
So for me, it came down to my exposure to all the different specialties in dentistry. I did have the opportunity before dental school to shadow some general dentists, orthodontists, endodontists, and eventually an oral surgeon. And from there, it was just the the specialty that most interested me. And so during my journey to dentistry, during college, I often tinkered on the thought of pursuing traditional medicine, but dentistry and head and neck anatomy took precedence. But hey, oral maxillofacial surgery filled all of those check boxes. It's a highly disciplinary, interdisciplinary field where traditional medicine meets anesthesia, meets head and neck dentistry. So, a field that encompasses a diverse range of procedures involving orthodontics via orthodontic, and then you got periodontics, you got ear, nose, and throat, maxillofacial trauma, plastic surgery, and restorative dentistry, all combined in one. And then, secondly, there is a significant patient impact, which provides treatment that often yields quick results. And you do that by restoring function, you can alleviate pain, improve aesthetics, and the self esteem of the patient. So that really drew me in. And lastly, I would say I was blessed to have great esteemed mentors who were pioneers in the field of oral maxillofacial surgery, such as Dr. Franklin Scott. He serves as one of the founders of NSOUNDS, the National Society of Oral Maxillofacial Surgery. Shadowed him before dental school and private practice. He served as a father figure, and I had the opportunity to see how he helped patients, which influenced me to pursue OMFS. Then you got retired Army oral surgeon, Dr. Perkins Davis. She serves as the program director and chair of Meharry Oral Maxillofacial Surgery program. She pushed me and kept it real with me, played a tough nurturing role, which helped me for the realities of the OMFS application process. She was the first board certified oral surgeon of African descent in the US Army. So she served as a great role model for me and a huge pioneer in the field of surgery. And lastly, General Bagby, this is the big one, who was the first Army dentist of African descent to be promoted to general. He always encouraged me and supported me along this journey. And he happens to be my fraternity brother too. '06 to the bros.
That's what's up. Well, so we hear a lot of uh, uh, me- uh, individuals related to your journey, right? People that mentored you, people that you visited, shadowed, people that you wanted to model, potentially model your career after, all of which are important aspects of being able to make that decision as to what specialty and why the specialty, and give you more insight so that when it's time to put your application together, you're ready to rock and roll. And let's talk about that next. Hey everyone, it's Dr. Darwin. Just want to take a quick break from this episode and hope that you are enjoying it. First thing I want to ask is, did you know that a large majority of the individuals like you who watch these episodes are not subscribed to the channel, to the YouTube channel? Nevertheless, we want to say thank you for watching and continuing to share these videos and episodes with others. Next, I want to say is subscribe. Yes, please hit the subscribe button so that you get these notifications each time these episodes are released. Last is I wanted to connect with those of you who are seeking to become an advanced dentist and specialist. And I invite you to our next event called the Get Into Dental Residency Challenge. This is a special 4-day event that will give you direct access to the mistakes that you want to avoid when you're applying to residency programs, and also the 8 steps that you also want to avoid so that you do not have an unsuccessful application submission. The information that we will be covering over the those 4 days will be some of the tips and strategies that I teach in my one-on-one and group coaching trainings with clients who are continually and successfully being matched into and selected into high-profile residency programs here in North America. So, if you're pursuing or aspiring to get into dental residency this application cycle, this challenge is for you. Check out the link below to receive more details and join the challenge. And also, I would encourage you to enroll in the challenge via the VIP experience. The VIP experience gives you actually access to a 1-hour Q&A session every day of the challenge before we actually get started with the challenge. And it guarantees me to answer your specific questions that you and other VIP experience members have on a daily basis. So I'll see you in the Get Into Dental Residency Challenge, and let's get back to this episode. This application journey, because all those things that you mentioned and a lot more go into the application. So let's talk a little bit about how you prepared your application steps above and beyond you having mentors that are already oral surgeons and some of the exposure. Talk a little bit more about that exposure and then what that translated for you as a dental student who has to start this application process, especially for oral surgery, pretty early, like D1, D2 year, if not a little bit before that.
Yes. So what I'll say about that is, you have your highly bright students. They can pick up information quickly. They don't have any troubles, no hiccups in the road. You have those type of students. Then you have students who, your everyday students, they struggle along the process. If you are one of those students, you got to know yourself well. Then you need to start the application process early. And what we mean by start the application process early is you got to start to build your resume and put together the pieces so that you're not scrambling last minute, because that makes it very difficult. In saying that, I would say, firstly, I had to work hard to keep my GPA above a 3.5 during dental school. It was ups and downs, but essentially I, did well in many of my classes, the high credit courses. I just tried to remain on course, even though, you're going to have some bumps on the road that may discourage you. Don't be discouraged. Just do the best you can and try to learn from your mistakes. Secondly, I prepared for the CBSE since my D1 year and took it several times. You'll have some people who they say to take it, during your D3 year and just focus on your grades D1 through D3. But my opinion on that is to expose yourself to, UWorld, which is a Q bank, a question bank that is considered the gold standard for questions to prepare for an examination called the Comprehensive Basic Science exam, which is used to apply for oral surgery program. It's essentially the same thing as the Step 1 exam. Took that several times, got to lay of the land with the type of questions that they ask, and just continue to prepare for that. And my score improved over several years and finally got it to a competitive point. Another point would be participated in several externships and developed relationships with program directors in a positive manner. So when I went to these externships, I reached out, I showed my interest. I really studied the program, what they had to offer, and just tried to make a great impression. A good resource for that to prepare for your externships is Oral and Maxillofacial Surgery Secrets. It's a book that you can find on Amazon. It not only teaches you different tips on, different just metrics that they ask for with certain procedures, but it also has a component in there, a chapter that tells you about the etiquette of going on a oral surgery externship, when to really not talk as much. Say, for instance, during surgery, you don't want to ask too many questions. You save those questions for once the surgery is done. You don't want to say, hey, doc, why did you do this in the middle of the surgery? And this, that, and the third. You kind of, unless they ask you. So there's certain etiquettes that will help just make you look better in their eyes. And because it's a lot riding on every single piece, and all the pieces have to come together. And then I would say I have a lot of tips on this. You have to build your extracurriculars. Don't go too crazy like I did in dental school. But for instance, I was involved in the American Student Dental Association, and as the president at Meharry, I managed large-scale dental clinics such as Meharry Oral Health Day. And so I was also president of Oral Surgery Club, president of my chapter, shout out the Chi chapter of Alpha Phi Alpha, and showed that I could be a leader and handle multiple tasks simultaneously. So I had much research experience in undergrad at the University of Pittsburgh and working at Merck, top 5 pharmaceutical company. So for me, research wasn't really something that I wanted to focus on. I wanted to focus on leadership, which is a hallmark of military officership. So for many of you, you may want to focus on a little bit of research, but at the end of the day, if you talk to many programs, they really emphasize the CBSE and your GPA / class rank over everything else. And I can't really speak on the match pass process for the civilian side, but I can tell you some general information about, what all programs look for, whether it be civilian or military.
Yeah, and those are some good things to point out, and I appreciate you kind of listing them out related to the application steps and things that are key for your process. Because the first thing that you said is, which is the first thing that people have to do, is start early. Some people will know, some candidates, those that are listening and watching right now, you will know before first year that you want to do oral surgery. You may not know until second year. It's fine. But the thing that you've got to do immediately is one of those tips about your application is that GPA. All of you start off first day of dental school with a 4.0. Your job, first semester into second semester, is to maintain that 4.0 GPA as best as possible. That's your job. Whether it's oral surgery or not oral surgery, because you don't know. So
You
that
want
would be
to
one of the ways to start, huh?
you want to keep all your possibilities open. In order to do
That's
that,
right.
grades up. So
That's right. That's right. So let's talk now a little bit about programs, because um one of the things that you mentioned was your appointment / responsibilities as a future military officer, meaning you're part of one of the branches of military. So when it comes to programs that you're looking for you exclusively, you have the option of both military-based dental residency training programs and possibly civilian-based, non-military ones. So talk a little bit about um, not necessarily the differences, but how you went through the process of determining what programs you wanted to apply to and why.
so I will have to slightly correct you on that. So
Hmm.
you were right in that I do kind of I had the opportunity, and we're saying that I'm a health profession scholarship recipient.
Okay.
And part of so I received a scholarship to pay for dental school. It's a full scholarship, 4-year scholarship. And when you're a scholar, they locks you into a 4-year contract with the military after you graduate dental school. So I had to apply to the Army residency programs. However, they do have a few spots available for civilians, but it's
Right.
very, I couldn't apply to all civilian programs. It's just University of Texas, Houston, and University of Texas, San Antonio were the 2 other oral surgery locations that I would be able to apply for. Ultimately, I chose to just pursue the military route because it wouldn't tack on to my obligation, and it gave me that option to, once I'm done with my oral surgery obligation after the residency training program, I will only owe them 4 years. From there, I can decide whether I like it or not. get out and come into private practice, or stay in and make it a lifelong career. With the other option, uh, where I have to serve and then I could take the civilian route, you locked into a contract where you have to add on years of your military service via going through the civilian program through the Army. So that was something that I just wanted to have more autonomy over my future. And so ultimately, that's the route that I chose.
Yeah, gotcha. And with your military commitment, as far as the health profession scholarship route, and your somewhat restriction to only really applying to or deciding to apply to more of the military-based programs than the civilian ones,
Mhm.
with that option, were you restricted to just the Army, or could you also do Navy and Air Force based programs?
So restricted to the Army. So how the military works is each branch of the military has a number of programs and spots. However, it's one application to apply for the entire network in your respective branch. So the Army has one, the Navy has one, and Air Force has an application process. Some of these bases in these Army medical centers where they have the oral surgery programs, they actually accept both Army multiple branches like Army and Air Force, but they only allot a certain amount of spots for those branches at that particular site. So you'll have only Army medical centers that only offer maybe two, maybe one Army oral surgery spot. Then you might have Walter Reed, who accepts Navy, Air Force, and Army, and they might have one or two spots for each branch. So it just depends on the different location. I applied and interviewed, like I said, once for the Army, and it consisted of 7 training programs with the Army and for 11 spots. So, and you rank the locations and you hope to get a 1-to-1 match. But with the Navy and the Air Force, I'm not sure exactly how it works, but it's very similar in that there's a limited amount of locations, but you get put in a pot of other candidates. And from there, you have to be like the top 10 or 11 out of how many apply pretty much.
Yeah, I got you. So one of the reasons you picked the programs and applied to the programs that you did was because of your health profession scholarship commitment and how that would impact your time after your board certification training, right? Uh,
Correct. Yes, sir.
so for some candidates that are listening and watching, some people may be involved in the military or want to go that pathway, so that's good to know. But there are other reasons why some candidates will choose certain programs to apply to. Um, and one quick fact is related to oral surgery is that there's a 4-year route and there's also a 6-year route, right? Usually the programs that have a 6-year route, you get an MD. You know,
Correct.
it's tied to you getting a medical degree in addition to your oral surgery certificate. And then there's the 4-year programs as well. So all those are factors that can determine or influence what programs you're going to apply to. But once you apply to a program and you get their attention, which is an important part with your application, then you get to the next phase and the next step, which is interviews. Tell us a little bit about interviews that you had and how your interview day went, questions that they asked related to why you wanted to become a board certified uh, or surgeon.
Just before I get into that great question, I just wanted to say that the currently the Army, I'm not sure of the other branches, they don't have any 6-year programs, and that's why they offer those routes to the civilian, those 2 routes, University of Texas Houston and University of Texas San Antonio for the 6-year programs, because currently the Army only had the 4-year programs, the non-MD programs, and for me, I didn't want to do the extra 2 years and take step 1 through 3 anyway. Same scope of practice. The MD does have its privileges, but for me, that was the route that I wanted to take because I feel like once I graduate, I don't know if I want to do bread and butter oral surgery. I might want to do a fellowship, but I just didn't want to tack on the extra years and all these extra exams. When for me, the most important thing is becoming board certified.
Yeah, yeah, that's key. So let's talk about the interview
Right.
day, how it went, what questions they asked, and why you think they were asking some of those questions related to your candidacy to be an oral surgeon.
So, one question that they ask is they said, if you were to describe what the field of oral and maxillofacial surgery is to a family member or friend, how would you describe it? So they just want to see how would you describe and articulate, on layman's terms to someone not in the medical field. And because on a day-to-day basis, you're going to have to explain everything, the intricacies of anatomy and oral surgery and just dentistry in whole to your patients, but you have to be able to articulate on a level that they can understand because they're not in the medical field. So that was one question that they asked. Another question that they asked was, what characteristic makes you different than other candidates? I think that was a pretty common thing. They just want to see what makes you stand out, and are you going to say something that's very generic, or are you truly somebody that has something special in you that's different than everybody else? So I think they asked that question. It was some generic questions. They asked, "What is your understanding of anesthesia?" That was a very broad question that kind of took me off guard because then I had to formulate a broad understanding of anesthesia and shrink it down to a pretty much a one or two liner. And then which is kind of not surprising, but it caught me off guard a little bit was, why is your GPA so low? Granted, granted, my GPA at the time was a 3.58, but in a highly competitive field, they expect much higher. It doesn't make or break you if you have so many other things to offer. But that was what they asked. And I had to explain my advances, my faults during my journey through dental school and how I had overcame them and how I will do things differently going forward. Because as everybody know, oral surgery, they when I got accepted, they said the easiest part is getting in.
Yeah,
So uh,
that's
they,
that's right. That's just like dental school. The easiest part is getting in. I know it sounds crazy. That is the easiest part of this whole entire process. Just same thing with residency. It's easy to, it's get like you're done. Like you got the hardest part done, so to speak. Or at least that's what you think. Nah, You got to get
no,
through now.
that CBSE was rough, but uh, yeah, that's what they tell us. So other than that, I didn't really have any questions that were I thought were unusual. Besides, they did say why your GPA is so low, and it was at a 3.58. And so I know that I guess they expect people to have like, I'm speaking to the consultant of Army oral surgeons after I didn't get accepted last year right out of dental school, and he said the a holistic candidate is the class president who has the 4.0. I was like, wow. I was like, their expectations are very high. It doesn't make or break you as a candidate, but you just got to be able to articulate yourself and just let them know, the reasons why, even though there are no excuses, the reasons why you didn't perform as much as you did. How did you overcome them, and how will you go do things differently going forward to prevent those things from happening?
Yeah, and I think that last piece you mentioned is very important, right? What challenges have you encountered? How you handled it, and and did I say and what you learned from that challenge? Meaning, what was your overall assessment of that challenge, and what are you going to do differently moving forward now that you've had a chance to evaluate your actions, make an assessment, so that what you did that was challenging or hard, you're able to better handle it if it comes up in the future. Very, very important, very key to be able to communicate that because
And mhm.
because not only once you get into oral surgery, and I think this is probably for all residency programs, but I think it's even more for oral surgery, which is expect to be challenged on a daily basis,
Great point.
right?
Mm.
I mean, I'm no oral surgeon, but I know a whole bunch of them, and I know their personalities, and I've heard stories of their own training while
Yes,
they were residents, and the amount of quote unquote oral surgery hazing that goes on
that doesn't
during
exist.
that time, right? During that time or during your time, it's like it's on a daily basis. Like you're gonna be the tooth fairy and or the chief of tooth fairy or surgeon dumb is gonna be hazing you every day. You're gonna be challenged every day, confronted with something that your faculty members, your attendings are gonna challenge you on it and expect you to be able to handle it,
What I
right?
will say, that's a great point. The organizations, non-hazing organizations, first thing. But what I will say is, they will challenge you. It's definitely training, like boot camp, and they're trying to train you because it's a vast amount of knowledge, and you have to really know these things on point. You have these people's lives in your hands. When they're on the operating table and you're in the OR, you gotta make sure you know your anatomy. You don't sever the carotid artery as you're going in, for certain things, certain structures, and is very critical. So the intense or rigor of it is definitely it's indicated for these programs. Now, maybe should they be a little bit, more constructive? One could argue that, but it may or may not yield certain results. As we know, if it's more traumatic, sometimes people associate that with remembering more. So they do make it tough for you, but it's for the betterment of yourself as a surgeon or any residency training program that you do.
Absolutely. And it's not meant to be a bad haze. It's meant to be a happy haze, right? For those reasons, right? Because you are expected as an expert and have the responsibility of someone's life in your hands, literally, right? So all of that's part of that process, and also those questions that you are expected to be able to answer and why they are asking those types of questions, right? So that's key. Next, we want to know a little bit more about your program because with military programs, there's not a quote unquote match, like you said, through the dental match or traditional match, but um, more or less through the military's process of how they do their selection. Talk to us a little bit now about your program. Uh, Describe and tell us about the program that you're at in Washington. You're in Washington State, right?
Correct. A little bit, maybe 10 minutes south of Tacoma, Washington, which is
Yeah,
45 minutes south of Seattle, Washington.
Seattle. So tell us about your program, what you like most about it so far, and what are some of the things about the program that continues to excite you, despite the fact that the rigor and the discipline that you have to have on a daily basis.
Yeah, so I'm at Joint Base Lewis McChord. It's a little bit south of Tacoma, Washington, and it's a great program, a diamond in the rough. Know everybody hears about the weather out here. It gets a little rainy, especially during the winter, from October to about March or April. But there are plenty, sunny days, and in addition to that, many areas outside of this area, like on the East Coast, Philly gets more rain per year annually than the Seattle area. Atlanta gets more. So on an annual basis, they get a lot more rain. So I just want to start off there. People look at me crazy and they say, "Hey, you out there? It rains every day. You're gonna get seasonal depression." I'm like, "I'll be all right." It's a temporary sacrifice. But it's a beautiful atmosphere. You have like the mountains, you have a lot of hiking trails, very outdoorsy. So me being a city boy, as I get a little bit older, I'm just trying to get more into the environment and the outdoor type of activities. So I think it's literally a breath of fresh air. So in the actual program is at Madigan Army Medical Center on base at JBLM, Joint Base Lewis McChord, and It's they complete a great amount of orthodontic surgery. So if you don't know orthodontic surgery, they literally pretty much break the jaw, the maxilla, or the mandible in order to reposition it for functional purposes. And so if somebody needs like they need orthodontic work and braces won't put their teeth back together, occlude correctly, then they may consider them a candidate for orthodontic surgery to achieve that. Even aesthetic properties of that procedure are really good. Then they do a lot of, at JBLM, they do a lot of dental alveolar, which is, taking out teeth, which is something, of course, I want to get great at, and a fair amount of trauma. So they do a fair amount of trauma. And currently, I chose, well, I'm happy that I was selected, even though I was trying to get back east to home or somewhere close to home, because I'm already acclimated here as an AGD resident, and I have established a great support system with the current surgical residents and staff. Their teaching style is very positive environment, and the former program director essentially, he drew me in. Another strength of this program is the Army's largest joint base with the Air Force. So we do see a wide range of patients. They are typically younger, and that's one issue with the military, that the patient demographic is a little bit younger and more healthier. However, we do see older officers, and we do see veterans sometimes and their families for certain procedures. So once I get done with the program, I will moonlight in order to get more experience with the other demographics. And then this JBLM program, they have a rich history, a track record for producing really good surgeons with a positive yet rigorous learning atmosphere. So that is what really drew me into the program.
Again, I may not have said it before, but thanks for your service as well as a former U.S. Air Force vet who has traveled as far west as you over in Las Vegas at Nellis Air Force Base, and then also overseas in Korea. I know the importance of being able to be responsible for service members, their families. So again, thanks for your service as well.
Thank you for
And
your.
also, yeah, absolutely, man. And also shout out to you said it earlier, you mentioned Philly. This is the third time you mentioned Philly. Shout out to Dr. Franklin Scott, uh, one of the godfathers of some organized dentistry and a good person, good mentor for a lot of people, not just yourself. I know about three or four other people that are from the Philly area that have mentioned Dr. Scott as an influential person to them, and which is important. It's important to have mentors. It's important to have connections with people, whether it's uh, getting into dental school, getting into residency, but especially when you're getting into residency, you want to be able to connect yourself with people that have done it and have the insights, have the tips, can share some advice as well. So that leads me to our next question, which thank you everybody for staying all the way through to this probably most important part of all of these podcast interviews, which are tips, advice. So Doc, knowing what you know now, especially since this is or has been a successful application cycle for you last time, but it wasn't your first one, right?
Yes,
Things
sir.
happen for a reason, right? But having that experience of applying to oral surgery, knowing what you know now, what are some tips and advice that you want to share with applicants who are listening and watching right now, knowing what you know? What are like three or four or five things that they must do right now? Like if they didn't learn anything else from our discussion today, what would those things be that they have to do right now?
All right. So we're gonna get into that. So some of the things I'm going to mention are very fundamental. They're very foundational. They apply to every aspect of life. And so one of those tips, those life tips, be resilient. You're going to take many losses, but you got to get back up. Learn from those lessons and correct them as you correct them, and just be greater. Uh,
Now,
mm,
now, key point here. Give us some examples of that because some people may think they're being resilient and it may not necessarily be getting them the result that they want because maybe their definition and their actions on how they're demonstrating resiliency is maybe not
Mhm.
quite right.
So I would say, for instance, in dental school, you know, I failed some practicals, and what did I do? Did I, put my head down? And no, I put my head up. I'd say this is a learning lesson. I got back in the lab. I practiced. I sat down with my professors and just got better from it. Just had try to have a positive mindset about it. At the end of the day, whether you get into oral surgery or not, right away is not life or death. Life or death is like your family and your family's health, your health. Those are at the end of the day, all of this kind of doesn't matter in life. Your relationship with God, your relationship with your family, whether they're healthy. So try not to put it on a pedestal, is what I would say. But when you're in school, just you got to sit down and you got to correct any type of thing that is wrong or you may have not understood, and you got to break it down so that you can understand it. So being resilient is just overcoming those challenges and those losses that you encountered. Maybe in dental school, maybe you're taking the CBSE and you bombed it. Well, you need to get back in the lab and you really got to break down it to a science of why you didn't do well and just attack it. And the resiliency is not only like what you do, it's a mindset. So you have to say that I'm going to do better with hard work and with the time and with the mentors. I'm going to do better. Whether I have a lot of help in my corner or not, I'm going to overcome. So that's resilience in my thought process. But if you want to continue with those tips, I was going to say be vigilant, be humble, but don't let a hard time humble you. As Nipsey Hussle said, you're going to be humble, but don't let a hard time humble you. And what I mean by that is, like you said, just get tough and still, don't put your head down. Put your head up with confidence. You failed an exam or practical, but don't just put your head down. Hold your head up and have the attitude that you'll kill it the next time. Some application tips that I have: prepare for the CBSE early. If you want to take anything from that, trust me, the people that they do it later, a lot of them don't do well, and they end up taking several gap years, and then by then some of them don't even make it back to apply, and they end up just they'll stay in general dentistry. But
Now,
um,
you say early for CBSE, what's your recommendation based on your level of comfortability and understanding of the content in the exam and where you were at dental school at the time, meaning second year, first year, etc.
to be honest, I think it's never you know a better time to start. You start like the earlier the better, essentially. However, in your D1 year, you do take a lot of core basic sciences like gross anatomy. You take a lot of these courses where that it would help with that curriculum. The thing about the CBSE, it's all medical based knowledge. There's very little dentistry on there. So like when you get into your D2 year, you're learning more dentistry related courses besides like maybe pharmacology and like one other course. I would say after your D1 year, you should really go hard with the CBSE if at that point you decided you want to pursue oral surgery, because you don't want to, it's just so much information. And you're essentially learning what medical students learn in 4 years outside of your dental school curriculum. And at every dental school, it's not like at some dental schools, they take classes with the first year medical students. Harry used to do that, but after COVID, they no longer do that. So like for the people who are preparing for the CBSE are at a disadvantage. And I know at other schools it's like that. But at some schools, they do take classes with the first year medical students. And so if you're definitely not in those classes where you're learning, you know, with that same type of strategy, because their questions are completely different. they're definitely like third, fourth order level type of questions. Then you should start early for sure. You want to try to get a score or of a 50 or higher. But of course, in the civilian world, a 70 or higher will get you to be a little bit more competitive. Can you get in the 50s? You definitely sure can. Like I said, comes down to who you know. Uh, did you make a great impression at your externships? Things of that nature. My next tip would be make sure that you complete at least 3 to 4 externships throughout your dental school career. And preferably once you entered the clinic, they really don't like to see you until you actually have some clinical experience. I've seen some people that go before, but like if you're not even actually teaching or not teaching, if you're not actually seeing patients and treating patients, then some of these programs are going to say, come back once you get a little bit of clinical experience. Because you might actually, on these externships, they might ask you to, while you're on call, to suture up a maxillofacial, wound or something like that. And it looks good when you actually know and have been treating patients.
Now, when you say 3 to 4 externships, are you talking about, of course, you're talking about oral surgery externships. They can be both within the school and external to the school, correct?
Correct. So if your school has a oral maxillofacial surgery program or any type of specialty program, then you can set it up so that you can spend more time with them. So that you might be taken away from your core patients, but you are essentially spending a lot of your time with them. The exception to that is some schools, like at my school, they don't, at Meharry Medical College, they don't really give us time off to go on externships. So I had to go during my spring break, Christmas break, Thanksgiving break, and I had to sacrifice those weeks to really go on those externships, and of course gain the letters of recommendation that I needed to be successful in the next application cycle. I don't know if that makes your point, but
Yeah, that's key because the timing of it is very important. Uh, the things that you're going to be doing potentially on the externship. I'm glad you mentioned the importance of having some clinical experience, meaning D3
mm,
year
mm,
or the summer, or that may be a more ideal time depending on how your dental school is set up. You may be in the clinic first or second year, but not too much as much as you will be as a D3 student. So externship, maybe doing your D3 as early as your D3 year, because you will have some quote unquote clinical experience, suturing classes, being able to
mhm.
diagnose some things or at least have some foundational knowledge, both didactically and clinically, about some subjects that or some parts that you may be asked over the externship, because even the externship is really a kind of like a test drive of them getting to know you a little bit better, but also you getting to know the program. But you also want to make sure that you have a positive experience that gets their attention. Oh, Dr. Reed, student Dr. Reed. Oh, yeah, he had a great externship slash. Not only will that give you an opportunity to really write something of importance for your application, but it also will be very favorable for that faculty member or doctor that you spent time with doing your externship, that will write you an LOR, letter of recommendation. Very key. That's why that externship is so important, especially in a competitive specialty like oral surgery. What else? What else? What other tips? You got five so far.
We could go on and on about this, but
Give us two more. Give us two or one more.
one.
Okay, that's fine.
So, firstly, I will say Oral and Maxillofacial Secrets book. You can find it on Amazon or just Google it. That is a very good resource just for going on your externship, what type of questions they might ask you. And it really looks good to know what what they're going to be asking you, what they could potentially, even if you don't really know it, you know, like you don't know the mechanism behind it, that's where you come in to study behind that and just reinforce that information. And so when they ask you, you'll be able to answer it correctly. And if you don't know it, you would just say, I don't know it. I'll get back to you on that.
Yeah.
They like
Or better yet, I don't know the answer right now.
right now, I'll get back to you on that.
Yeah.
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 Uh,
We'll put that link down below. Oral
yes.
Surgery Secrets book.
Okay. And this other link is called accessomfs.com. This is a website that I've used where it pretty much discusses everything related to oral surgery application cycle. Like it has it listed on there when you should apply and how that looks like over your D3, D4 year. It also has information about navigating a DIA pass for oral surgery applications, things that I can't really talk on. They have other information on there as far as, let's see, I'm on it right now. They just have different program glossary, so you can search different programs. And then they have different resources on there, like they might mention the book that I mentioned before. So this is a very good resource when you're applying the oral surgery, and I could not recommend it more highly.
Yeah.
So much resources on there.
What's one thing you would do differently?
One thing I would do differently, to be honest with you, I think I bit off a little bit more than I chewed in dental school with the leadership. I know that I said I wanted to kind of focus on that because in undergrad, I did a lot of research. And so when I got to dental school, I wanted to be more involved. I think I did a little bit more than I probably should have and should have focused a little bit more on those type of things, like the CBSE. You know, I did take it a couple more times that I wanted to, that I've liked. And of course, if you have the opportunity to get into oral surgery right out of school, then definitely do so. But I think some of those things kind of it really challenged me time management wise, and I kind of suffered a little bit on the back end. So during my D4 year, I had to tinker some things, and when I applied the next year, I was more successful. So just don't bite off more than you can chew. If you're going to do something extracurricular, try to make it one very significant, and try not to be involved in like 10 different things, because at the end of the day, they care about your CBSE score and your GPA. That matters more to them. Unfortunately, you would like to think that they would be more holistic, but those metrics matter more in that process to them than the extracurriculars.
Yeah. And I would like to add this. Even though that is the case, it's still that participation and those extracurricular activities still have a significant impact on who you are as an individual too.
Definitely.
All right. Because all of these programs, whether it's oral surgery, endo, pedo, they're also recruiting not only the cream of the crop as dentists, new dentists, but also the cream of the crop who happen to be people or persons.
Like leaders and all types of.
Very, very key. So, that's part of what's been in your DNA for a while, Doc. Your ability and desire to help others, and being a leader is service to not only the people that are in the groups and organizations with you, but also to the mission of those groups. So, yeah, I get it. Yeah, don't want to be involved in everything, but something involved to kind of satiate your desire to lead and want to be connected. And all of those things also help with you dealing with people, communicating with people, relating to people, serving people, the things that you will be doing as a board certified specialist, in this case, a board certified oral surgeon. So Doc, what's the best way for people to get in contact with you if they have some more questions?
All right. Well, thank you for having me. And the best way to get in contact with me, you can message me on LinkedIn, Sheream James Reed. I'm also on Instagram, The Mad Scientist, spelled THA.MAD.scientist. And then Twitter, Surgical With It 06. And, just feel free to, if you have any questions about the process, especially if those who are going the military route, I'll be able to, lead you, guide you into the right direction.
Well, we appreciate your direction that you've given us as far as your journey and how that has directed you to your successful match into oral surgery. We wish you continued success, and we say thank you. Thank you.
Thank you for having
me. From the alpha to the omega, we making sure that you all are listening, get this information. Please like, subscribe, and most importantly, go to the next video right now. All right. Love, peace, and smiles. Go to the next video.
All right, sir.